watching The Last Katoto, it shows us that emotions are a very critical part or plays a very critical part in our human experience. Sometimes we laugh, cry, but sometimes also our emotions get out of hand. The sadness we feel isn't just the blues, it could be depression. It turns out that depression is not just feeling sad, it's a condition that can affect a person's daily life. Depression, by the way, is very common. It affects 10% of the world's population, making it a leading cause of disability. One of the major confusions in understanding depression comes from finding the difference between having the condition and just feeling depressed. And mind you, nowadays, a lot of people use it commonly. Like, I wanted to eat pizza, but the pizza house or the pizza store is closed. I feel so depressed. So it's just so common to say it. Almost everyone feels down from time to time. Stereotype tells us that depressed people are weak unless they happen to be tortured artists. It can be difficult to understand depression due to the fact that it's a mental disorder. It's a little difficult to understand as compared to a person having high cholesterol. It's a disorder defined by thoughts, behaviors, and feelings, rather than the obvious, like vomiting, rashes, or having a fever. Those who have experienced depression are all too familiar with comments from misguided friends like, snap out of it, stop feeling sorry for yourself, just do something about it.
Hindi siya totoo, ang mariing sambit ni nanay. Pagod lang yan siguro, magpahinga ka na lamang sa kwarto. Sa mga oras na yun, alam kong ako'y mag-isa. Kaya piniling umiyak na lang sa sulok at damhin ng pagdurusa.
This leads to one blaming themselves for not stopping out of it. It's like their own fault, just like in the movie.
Ayoko nang mag-aral. Ayoko nang pumasok. Ang mundong ito ay nakakasulasok.
Depression comes in various forms, but most of these forms come with the same symptoms. They just vary in severity and length. Like having a bad day, losing your job, having an argument with a loved one. Even a rainy day can bring feelings of sadness. Sometimes, there's no trigger at all. It just pops out of the blue. When things change, and those feelings of sadness disappear. Common symptoms of depression can come from feelings like constant sadness, anger, guilt, and hopelessness.
Taglian kang dumating kasabay ng salita ni nanay na may tangis at hinagpis. Nangabilang bahay si tatay at dito ko nalaman ang ibig sabihin ng salitang lumbay. Hindi ko alam kung ano ang aking gagawin. Iiyak? Sisigaw? O magpapatangay na lang sa hangin?
That particular part of the movie showed you the symptoms she felt. Next, there are symptoms that are related to behavior. They include social withdrawal, a lack of energy, low motivation, poor concentration, sleep problems, or significant changes in appetite. Finally, symptoms related to thoughts would include poor self-esteem, thoughts of suicide, and loss of interest for regular activities. Mind you, if you have at least 5 of those symptoms, you qualify for a diagnosis of depression, according to psychiatric guidelines. When a person experiences these symptoms for at least 2 weeks, and it's already interfering with your daily life, that is what we call major depressive disorder. This is what one normally thinks when you think of depression. It's a medical condition, meaning it won't go away just because you want it to. These symptoms are often cyclical, or they follow a cycle. They may come and go over periods of months or even years. In the case of the movie, it went on from elementary up until high school. But if these symptoms go on for more than 2 years,
Nung ako'y nasa kolehiyo, ang relasyon natin ay mas lalong lumalim. Matapos durugin ng isang binatilyo ang aking puso't damdamin.
see, it showed you it is now what we call persistent major depressive disorder. And you have to remember, it is not just the symptoms that appear when one feels depressed. There are also physical manifestations inside the brain.
Brain imaging studies show that depression is connected to changes in several parts of the brain, especially in 3 core areas. The first is the amygdala, which regulates emotions like anger, pleasure, and fear. When a person is depressed, the amygdala can become overactive, causing problems with sleep and behavior, as well as balance of key mood hormones. The second area is the hippocampus, which processes memory and regulates stress hormones such as cortisol. One study found it's up to 13% smaller in depressed women, and excess cortisol can stunt the growth of new neurons, creating poor moods and memory. The third main area is the thalamus, which helps link sensory information to good and bad feelings. Problems in the thalamus may be linked to conditions such as bipolar disorder. Changes to these parts of the brain and others mess with key hormones, such as serotonin, which regulates sleep and mood, and norepinephrine, which affects motivation.
All the 3 parts that was shown earlier of our brain that show distinct activity even in the size of that particular part of the brain will show you that being depressed is not just random. It's not just a chemical imbalance. It can also be brought on by specific situations and life changes. An example of this is postpartum depression, which occur after a person gives birth, and seasonal affective disorder when there is a lack of sunlight, especially during rainy season or during the Burr months, and especially during Christmas holidays. This can trigger symptoms of depression. Because you have to remember, depression can look like normal sadness. And because it's not always obvious what caused it, sometimes it's hard for people to believe it's real. That's why some people argue that if you just try hard enough, you can break the cycle. You're in control of your own emotions, so you can choose to feel better. It can be difficult to think of these thoughts, feelings, or behaviors as symptoms to many of us because they're all in our head and they seem it's just a matter of decision. Like to someone who is depressed, it's like you chose to be lazy and sleep all day. Or you decided to stop spending time with your friends because they have a bad attitude. But remember, what's in our head, it's imaginary. Our thoughts, our feelings, and our behaviors are influenced by a complex series of chemicals in our brain. Anyone who suffers from depression can say that's not true. We're still trying to figure out what causes it and what exactly it does to our brains, and it's important that our doctors and scientists keep on working to understand the workings of this condition and get the patients back on their feet. So far, they have already identified some causes of depression, as I mentioned earlier. You have to remember that it can be because of a genetic component. Like if your parent or sibling has it, it's more common that you might also have depression. It can be linked to environmental factors like abuse, neglect, severe stressors like financial instability, peer pressure as shown in the movie.
Nagtagpo muli tayo rito sa paaralan. Hindi para ako'y proteksyonan, kundi para kaawaan. Sa mga matang mapanlait, sa mga matang mapanghusga, sa mga matang malulupit, sa mga matang mapangmata.
For death in the family, all make it more likely for a person to develop depression.
Ikaw ay lumapit at bumulong sa akin. Gusto mo bang patuloy na magdusa ang iyong damdamin? Bakit di mo nalang wakasan ang buhay mong angkin?
Treatment for depression usually includes psychotherapy and medication, or both. Either can work on its own, but the combination of both medication and therapy has been found to be the most effective. In summary, depression is a disorder that is widespread but poorly understood. The symptoms can negatively affect a person's thoughts, feelings, and behaviors to a certain degree. However, treatments that include medication, psychotherapy, or a combination of the two can help to eliminate the symptoms of depression. If you or a loved one has experienced depression, I hope that this particular activity has helped you understand this condition a little bit better. So how do you prevent feeling depressed? And identify what triggers it. When you feel the symptoms starting, try to pause for a moment to notice what triggered it. Anything that causes emotional, physical, or mental stress can be a trigger. There are general categories of stressors that affect everyone to some degree, but specific triggers will be different for everyone. It's also helpful to identify other things that trigger the depression for you. When you feel threatened or afraid, pause and look for behaviors, bodily changes, or warning signs that are happening at the same time. A good way to do this is mindfulness. What is mindfulness? Mindfulness refers to staying in the present and being aware of what you're feeling, thinking, your bodily sensations. Is it too hot? Is it too cold? Is your chair that you're sitting on comfortable enough? What is the stimuli from your environment? Don't try to judge or label the situation as good and bad or bad. Focus only on the current moment, not future tasks or past problems. Mindfulness takes practice, but it can be done at almost any time. When you're waiting in the car, for example, or going for a walk, take time to focus on what you're thinking, what you're feeling, and what's happening around you. Take the time, pause, and look around. At first, your mind will quickly start to wander. With more practice, though, it's easier to stay on in the moment. Another way to stay present is to focus on your breathing. Focus on the air moving in and out of your nose and how it changes between inhaling and exhaling. Notice which parts of your body move when you take a breath. Remember that just when the caterpillar thought the world was ending, she became the butterfly. Life is not about waiting for the storm to pass. It's about learning to dance in the rain. Thank you and good day to us.